Yep, this is Dr. Petrapoli, and we're going to talk about what we can do for snapping elbow syndrome. So I've done a couple posts on medial snapping elbow syndrome, and that's where the ulnar nerve is snapping across this medial epicondyle, the funny bone. And then we showed the video of Kale with the possible ulnar nerve versus the medial head of the triceps. Also, you can get snapping on the lateral side of the elbow. The radial head here has a ligament that goes across it. That can snap. There can be a plica, there can be inflammation within the joint, synovitis, there can be arthritis. So there's a lot of reasons for snapping. The most common question that I get, especially in throwers, is what can be done about this ulnar nerve that's snapping back and forth? Well, a lot of times with rehab, we can calm the symptoms down, but mechanically, if it keeps popping back and forth and it's bothering you as a pitcher or bothering you as a thrower, it's going to be a problem. And a lot of times it'll cause numbness and tingling in these fingers. So if it's causing numbness and tingling, it's not getting better with working with your athletic trainer, with a physical therapist. There is a surgery called an ulnar nerve transposition. It is surgery. You go to the operating room, make an incision about this big, and we actually take this nerve and transpose it from coming behind this to in front, so it comes in a straighter path. And a lot of times we'll suture a little layer of the fascia, which is the kind of white stuff you see on a piece of meat, over the top of this to hold it in place so it doesn't keep snapping back and forth. At the triceps, a lot of times that'll get better with physical therapy, sometimes a chiropractic treatment, sometimes that might need surgery, trim some of that. That's very rare. And then with all the other stuff that's going on inside the joint, we do elbow arthroscopy, where we put little poke holes in the joint, pump fluid, little fiber optic scope, take out the loose bodies, smooth things over, shave the plica, whatever needs to be done. But we can do a lot of that arthroscopically. But I just want to talk about that ulnar nerve one as well. So stay tuned.